Annual Training for Health Services. I am Ernette Visitation, Registered Nurse and District Nurse Supervisor. The objectives of this presentation includes Safe Schools online training, letter of intent for medication administration, confidentiality, nurse delegation, life-threatening health conditions, and skills competency. Safe Schools online training is an annual requirement. Assigned are modules that will provide you with a brief overview of skills and responsibilities while performing tasks in the health room. Letter of intent. In reference to the Revised Code of Washington, RCW 28A.210.275, voluntary, written, current, and unexpired letter of intent stating the willingness to administer medication or nursing services. The letter of intent provides protection to trained staff through the Good Samaritan Law. It differs from a PDA or parent-designated adult for students with diabetes or seizures. It is only for delegated services not previously recognized in law. It is not needed for oral medications such as pills, tablets, or syrups, nasal sprays, eye and ear drops, or bladder catheterization. Confidentiality. Health records are legal documents that are confidential and protected by state requirements and the Family Education Rights and Privacy Act, also known as FERPA. Healthcare information about a student cannot be disclosed without a signed consent of the parent or guardian unless the student is 18 years of age or greater. There are exceptions in selected situations identified by a licensed healthcare provider or nurse. Health-related information should only be released through your building nurse. Student health information is shared with other staff only on a need-to-know basis. Share student health information with staff only if it is to ensure the safety and well-being of the student. Nurse delegation. A registered nurse may delegate nursing tasks to another individual when the registered nurse determines it is in the best interest of the student. Nursing tasks may be delegated to health room assistants, certain paras, and office professionals, either head OP or attendance OP in elementary schools. After the individual has completed their Safe Schools training and hands-on training, the delegating nurse will determine the competency of the individual to perform the task, evaluate the competency of the individual to perform the task, supervise the actions of the person performing the tasks, and delegate tasks that are within the nurse's scope of practice. Life-threatening health conditions. Prior to attending school, parents are to complete a Student Health History Form, or SHH. The purpose of the SHH is to ensure students with a life-threatening condition are identified before starting school. Alert your building nurse immediately if you receive an SHH with a life-threatening condition noted by the parent or guardian. Inform the parent or guardian that the nurse will need to meet with them before their child can start school. The nurse will contact the family to obtain necessary documentation before the student may start school. Here is a sample SHH that is located on the district website under Health Services. Note the life-threatening conditions that are highlighted on the left. Also note the state law requirements highlighted on the right, which reads, state law requires the students with life-threatening conditions such as anaphylaxis, asthma, seizure, cardiac, hemophilia, or diabetes have a parent meeting with the school nurse and care plan completed prior to the first day of school. Skills competency. Skills competency is a hands-on learning portion that your building nurse will review with you in the fall. Some skills include medication administration, AED and 911 protocol, blood exposure protocol, severe allergy and EpiPen training, how to treat students who have asthma, diabetes, and seizures. In conclusion, this presentation went over Safe Schools online training, letter of intent for medication administration, confidentiality, nurse delegation, life-threatening health conditions, and skills competency. Let's all work together to keep our staff and students safe and healthy. Thank you.